California declaring a state of emergency due to bird flu this week as the first severe case in a human has been confirmed in Louisiana, raising questions about the increased dangers of the illness. Here to discuss what this and other big health headlines mean for you, public health specialist and primary care physician, Dr. Saju Mathew. Doc, always great to see you. Good morning.
Good morning, Hena.
We know the CDC has confirmed the first human case of severe bird flu, with the agency noting the virus found in the patient is different from the one that we hear spreading across livestock. Doc, can you explain to me the difference and what risks it poses to us humans?
Yeah, so far we have about 64 cases of bird flu. Most of them, except for this one case in Louisiana, were in cattle commercial workers. So we know that there was an infected animal that transmitted that infection to these workers. And all of them recovered just fine. They were just mild symptoms. But in this one particular case, it was a 60-year-old patient from Louisiana, as you mentioned, who fell severely sick. So this is the first case of severe illness from bird flu. But check this out. The contact was with a wild bird in the backyard. So a little bit of a different route of exposure and definitely severe illness. But so far, the CDC says that the risk to the average human is low and that there's no person-to-person or community transmission.
That's good news so far. We mentioned California declared a state of emergency. What should people in that state and, of course, other states know?
I think you should be vigilant. You know, if you work with wild animals or you work with poultry animals, make sure that you wear a mask, make sure you wear gloves, avoid raw milk, because when you actually pasteurize the milk, you can kill the virus. Stay vigilant and, like I said, avoid direct contact with wild birds.
Let's move on. This week, the FDA announced new rules on what can be labeled healthy. I'm so intrigued by this story. Break down what this new rule is, Doctor.
You know, I'm always excited, Hena. I tell you how excited I get when we talk about diet and fitness. So finally, after 30 years, the FDA will actually put a logo, a symbol in front of food packaging. So you can walk into a grocery store and not be helpless and hopeless like me when you get lost in all the jargon on the back of these food products. So now there'll be limitations on how much sugar can be in there, how much saturated fat. Make sure that you're eating more vegetables and whole grains. So I'm telling you, this is about time, and it will help, especially people like me who are single, eat healthier and be more consistent.
Yeah, I think this is a great idea. I'm with you there. There's another new recommendation this week. It says taking both calcium and vitamin D supplements will not help prevent fractures in older Americans. I'm tiny. I take those medications or those vitamins for that reason. What are ways older generations can protect from falls, and does it help with younger people to maybe avoid that as they get older?
Yeah, well, Hena, listen, I take vitamin D as well. I'm a huge believer that vitamin D has actually a lot of nutritious value. So what this study is basically saying is that in older women, in postmenopausal women, in older men, that taking vitamin D and calcium does not prevent a primary bone fracture or a fall. It doesn't mean that you shouldn't take vitamin D. In fact, I think patients 50 years and older should take vitamin D. But for the older population, Hena, here's the big deal. Make sure that you are adequately screened for any vision and hearing problems. Make sure you're screened for osteoporosis. And if you are taking vitamin D and calcium, continue to do that. And one last thing, I'm a huge proponent of strength training, because that can also prevent falls and deaths from falls.
I have a minute left, but a lot of us in the newsroom talking about this next headline. There's a new study. It claims a small glass of wine per day can help protect heart health. I always hear different things about wine, but medical experts like yourself disagree. Tell me why.
You're going to get me in trouble again. We're going to end on a sour note, because I'm going to say do not drink wine. And here's the reason why. A 4-ounce glass of wine, yes, everything in moderation is fine. If, in addition to that, you're exercising, you're not smoking, all of that absolutely will help. The problem is when you tell patients you can drink wine, they're going to drink more than a glass or two. Now, alcohol-related health risks we know come from heart disease, stroke, and cancer, even diabetes. So ultimately, that whole paradox of little wine is good, more than a little is bad can be so confusing. So just don't drink wine. If you do, drink in moderation. but do everything else to protect your health.
Everything in moderation. Always great advice. Happy holidays. Thank you again, Dr.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.